The outbreak of coronavirus, which started in China, changed the world. A new normal was developed as the world grappled with getting the spread of the virus under control. The United Nations has called for a new deal to support countries that have experienced devastating impact on their economies. The World Health Organization has made an appeal to heads of state and government around the world to work together and calling on the G7 and the G20 summits later this year to yield tangible aid commitments.
If we can compare what we have achieved this time to the past, for instance, treatment against HIV arrived in Africa 10 years after it started being used in the north. And the other tragic example is the H1N1 epidemic, which actually had also some interventions in terms of vaccine development, but the vaccines developed actually arrived in Africa after the pandemic was over. So if you compare what is happening now with the past, I think the arrival of vaccines is just a few months apart. There is improvement, although still we don't think that it's enough. And the arrival of other tools is also has improved. But we shouldn't settle on improvements. We should really do the right things. And that's why I fully agree with Prime Minister Sture that we should continue to advocate, because this is a common threat, the current pandemic, and we need to fight it together. That's why we say, we call this campaign Act Together. It affects the whole world, and as Prime Minister said, it's in the interest of each and every country to work together. I think a common threat has to be fought only in unison. So I think we have learned our lessons from this, and we need to continue learning from this unprecedented crisis and prepare for the future also all the investments in the north and south based on this principle. It's a common threat that can affect everything, health, economy, social, political, and security issues. So we have to, in the investment also, we have to see it that way. In terms of the funding, for instance, the gap we're saying $16 billion now. I was talking to some finance ministers a few months ago, and they say this is actually a rounding error when we, when we draw our budgets and so on. It's not really a big amount of money. And if there is commitment, I think it can be done. It can be done. And we're not asking really something that's not doable. If the finance ministers call it a rounding error, I don't think they're wrong, because that's their job. Actually, they know it very well. But the key is the commitment, as Prime Minister said, and understand that this is a shared problem or a common threat that has to be fought together, and that it's in the interest of each and every country. And I underline, it's not charity. It's not charity. And like Norway did and other countries, I said earlier, they have already contributed their fair share, and they can do even more. If each and every country that can pay can do its fair share, I think we will be there.
The WHO Access to COVID-19 Tools Act-Accelerator is co-chaired by South Africa and Norway. The agency, which works at alleviating inequality, needs funding in order to reach its goals.
There are a number of events coming up where countries in the north will be gathered, partly with other partners in G20. There will be G7. There will be the upcoming different UN gatherings. And, having worked with WHO in the past to see how good advocacy on very attractive health investments, global health, public goods, have achieved results. I'm confident we can do the same this time. We can come up with text to the final communiques of the G7 and the G20s and all the rest that really highlight how this kind of investment is of public health interest, security interest, and development interest. So that's the way you have to bring home the argument to leaders that it is really in their interest to stay committed and be engaged.
The funding gap of $16.2 billion pales in comparison to what the developed economies have spent on their domestic responses. As co-chairs, South Africa and Norway have written to more than 50 heads of state and government asking them to contribute their fair share of financing to Act-Accelerator agencies. This funding is vital if we achieve the global targets for access to vaccines, tests, treatments, and PPE, and of ending the pandemic in 2022.
Sophie Mkwena, SABC News, Johannesburg.